Hello everyone, my name is Gregory Moracle and this is Versa Thai Yoga. On this video I'll be talking about the breath, more specifically breath retention. So if you've been in any of my yoga classes or if you've watched any of the videos, you will notice that I recommend to inhale, hold the breath, and then stretch. And this might be opposite of what you've learned in other types of yoga classes, and I will explain why we do this in this video so that you can keep that in mind while you practice these techniques as I instruct them. So before we go into that, I will just make a special note that if you are going to try this practice of breath retention while you're stretching, you might want to see the doctor if you have certain conditions and ask them if it's okay for you. So high blood pressure, eye disorders that might be affected by pressure in the eye socket, and also pregnancy are all contraindications for this type of practice. So just be safe. Otherwise, you should be fine. And so this type of breath retention that we'll be doing is called Antara, Khumbhaka in Sanskrit. So there it goes into Hatha Yoga, and a lot of stuff is shared and there's a lot of things that aren't, and you'll see that throughout these videos. So when we do a deep stretch, we want to make it in Thai Yoga. From my teacher, the way that I was taught, the philosophy is to provide the most resistance to create the deepest stretch. So in other types of yoga, when I was trained before, you would like to stretch the arm, for example. This is the best example. We inhale, and then if you exhale and stretch, you can stretch way further because your deflated lungs have less resistance and you're able to stretch a little further. But if you want to inhale, hold the breath, and then stretch, your inflated lungs have more resistance, your rib cage is expanded, and that same length of muscle has to stretch further across your back to get into that same position where you were with the deflated lungs. So you're stretching it further. And so that's the reason, that's the core concept of why we do this. Another example you can see clearly in the cat and cow. We do the reverse of what you would normally see. So as you inhale, you will arch the back for the cat. So inhale, you fill up the lungs, and then arch. And exhale as you bend the back. So if you try this yourself, so typically it would be exhaling as you arch and inhaling as you bend, which feels natural with the breath. But if you provide these opposite movements with the lungs, you'll get more resistance and the stretch moves to a different area. So with the typical method, you'll be stretching more of the muscles along the back and in the abdomen and chest as you exhale to arch and inhale to bend. But with the opposite, what we do in the Thai Yoga, inhale to arch the back and exhale to bend, you're moving the stretch more internally. So you'll stretch like the intercostal muscles between the ribs, and the muscles in the more core layers of muscles will be stretched compared to the other version. So one is not better than the other. We're just utilizing the motion in a different way. And that's the way that we do it in Thai Yoga. It's the way that I was taught. And I hope this makes sense to you. So thanks for watching. If you enjoy this, please share with someone that might like this. Like the video. If you want more of this content, we'll keep putting it out. So if you press subscribe, and the bell icon will notify you whenever that comes out. So thanks again. Thank you.